Bismillah Rahman Rahim. Assalamu alaikum. Do you know there is a virus silently affecting thousands of people every year, especially our kids and elders? And most of us have never heard of it. A virus that is often mistaken for a common cold can send children to the ICU. Let's talk about Human Metapneumovirus or HMPV. Imagine your toddler has a fever and difficulty breathing. You think it's just another cold, but it turns out to be something more serious: human metapneumovirus. HMPV is a respiratory virus which affects millions of people globally, especially in countries where respiratory illnesses are already a major concern. And Pakistan is one of such countries. HMPV is a virus that targets the lungs, causing symptoms like cough, fever, and breathing difficulty. It's especially dangerous for children, the elderly, and those with weak immunity. The good news is you can protect your family with simple habits like washing hands, wearing masks during flu season, and keeping surfaces clean. By understanding this virus, we can protect those we love. Keep watching to learn more about symptoms, treatment, and how to prevent HMPV. Together, we can fight against HMPV by spreading awareness. I want to share with you the story of Ali, a playful 3-year-old kid who suddenly found himself struggling to breathe. What started as a mild cough turned into something far more serious, and his parents had no idea what they were dealing with. Ali was a healthy, active child, but one evening he started coughing. His parents assumed it was just a seasonal cold. By the next day, Ali had developed a fever of 102 degree Fahrenheit, a runny nose, and was unusually tired. Within 48 hours, things took a turn for the worse. Ali began wheezing and his breathing became labored. His lips started to turn slightly blue, a sign of low oxygen. Alarmed, his parents rushed him to the emergency room. At the hospital, doctors conducted series of tests. They initially suspected pneumonia or influenza, but the results pointed to something less familiar. Human Metapneumovirus or HMPV. It is a common virus that can be serious in young children. Ali was given oxygen support to help him breathe and fluids to keep him hydrated. Since there is no specific antiviral treatment for HMPV, the medical team focused on managing his symptoms. After a week in the hospital, Ali finally started to recover. Ali parents learned an important lesson. HMPV can seem like a simple cold, but it can escalate quickly, especially in children under 5. Knowing the warning signs can make all the difference. Ali's story is a reminder that awareness saves lives. So share this video so more parents can recognize the symptoms of HMPV early and protect their children. Another case history. Mr. Rahimdad, a 68 years old man with type 2 diabetes. He was living an active and independent life. But things took a sudden turn last month when he developed what seemed like a simple cold. It started with a mild cough and fatigue, symptoms many of us might dismiss. But within a few days, he experienced shortness of breath, fever, and wheezing, which alarmed his family. When he was brought to the hospital, his oxygen levels were critically low. He was diagnosed with severe viral pneumonia caused by HMPV, a respiratory virus that mimics flu but is lesser known. Managing Rahim Dad's condition wasn't easy. His diabetes made him more susceptible to complications like low immunity and delayed recovery. He needed oxygen support and close monitoring. After a week in the hospital, thanks to early diagnosis and supportive care, Rahim Dad recovered fully. But this case left his family and doctors wondering, why isn't HMPV on more people's radars? Why we don't think about this? HMPV is a respiratory virus like respiratory syncytial virus and influenza. It spreads through droplets when we cough, sneeze, or touch contaminated surfaces. Elderly individuals, people with diabetes, heart disease, or lung problems, and those with weak immune systems are at higher risk of acquiring this infection. Rahim Dad's story reminds us how even a small cough can spiral into something life threatening. Awareness and early action saved his life. So let's spread the word about HMPV. Remember, HMPV might not be a household name, but it's a virus we all need to know about, especially for the sake of our children, elders, and those with weak immunity. Early recognition of symptoms like fever, wheezing, and difficulty breathing combined with basic preventive measures can save lives. HMPV stands for Human Metapneumovirus. It's a respiratory virus that is part of the paramyxovirus family. It's a significant cause of respiratory infections, particularly in children, older adults, and immunocompromised individuals. Let's have an overview of the key facts about HMPV. Discovery: it was first identified in 2001 in the Netherlands, but is believed to have circulated in humans for decades before being discovered. About transmission: two modes of transmission. One is airborne transmission, second is close contact. In the airborne transmission, HMPV is primarily spread through respiratory droplets, such as those produced by coughing or sneezing. Regarding close contact, the virus can also be spread through close contact with an individual person. Few words about the symptoms. It can have mild symptoms or severe symptoms. The mild symptoms include fever, cough, nasal congestion, and sore throat. While severe cases, they have wheezing, difficulty breathing, bronchiolitis, and pneumonia. The high-risk groups to acquire this infection includes infants and young children, elderly, especially those with chronic medical conditions, and number three, individuals with weak immune system. How HMPV is diagnosed? Detection typically involves PCR, polymerase chain reaction testing of respiratory samples, or antigen-based testing. What are the complications of this disease? It's respiratory failure as well as secondary bacterial infection. Regarding respiratory failure, in severe cases, HMPV infection can cause respiratory failure, which may require hospitalization and mechanical ventilation. Regarding secondary bacterial infections, HMPV infection can increase the risk of secondary bacterial infections such as pneumonia. Few words about the treatment. There is no specific antiviral treatment for HMPV. Management is supportive and includes hydration, antipyretics for fever, and supplemental oxygen for severe cases. In severe cases, antiviral medications such as ribavirin may be prescribed. The most important aspect is prevention, and it includes good hand hygiene, avoiding close contacts with sick individuals, and cleaning frequently touched surfaces. What about vaccination? There is no vaccine available for HMPV. However, researchers are working on developing a vaccine. HMPV is considered a common cause of seasonal respiratory infections, typically peaking in late winter to early spring in many regions, including Pakistan. Few words about HMPV in Pakistan. Human Metapneumovirus has been present in Pakistan since 2001, when first case of HMPV was diagnosed here in Pakistan. Over the years, several outbreaks have occurred, primarily affecting children. For instance, a 2015 study at the Pakistan Institute of Medical Sciences Islamabad PIMS identified 21 cases of HMPV among children hospitalized with severe lower respiratory tract infections. In light of recent surge in HMPV cases in Pakistan, it's good that Pakistani health authorities are closely monitoring the situation. The National Institute of Health (NIH) has emphasized that HMPV is not new to Pakistan, and the country possesses the necessary diagnostic tools and expertise to detect and manage HMPV cases. The NIH advises the public to remain calm and focus on preventive measures such as regular hand washing and proper coughing fatigue to avoid contracting viral illnesses. So, Alhamdulillah, there is no danger of another lockdown like Corona here in Pakistan or even in the other countries in the world. Currently, Pakistan is experiencing an outbreak of seasonal influenza, including influenza A and B. Health experts recommend adopting preventive measures and seeking timely medical attention to manage symptoms effectively. In Peshawar, local health authorities are vigilant and prepared to respond to any potential increase in HMPV cases. Residents are encouraged to maintain good hygiene practice and stay informed through official health advisories. Together, we can create a healthier community by spreading awareness, not the virus. So share this video with your family and friends because knowledge is the first step in prevention. By staying informed, we can protect our loved ones and ensure that everyone breathes a little easier. Let's fight HMPV with awareness and care. If you have any questions or personal experience with respiratory infections, drop them in the comments. Let's start a conversation.